to heart, soul to soul. Let's speak our minds and make it plain. I'm here for you, you're here for me. Together let's stand, it's heart to heart.
Welcome to Heart Chat Show. This is an educative and entertaining talk show that brings about honest conversations discussing various topics, which includes social issues, relationships, health and well-being, and spiritually uplifting conversations. My name is Adra Arma, and today we want to talk about the impacts of COVID-19 on Black and Asian communities. Now, according to reports, they say that Chicago only has 26% of African American population. However, 70% of the deaths from COVID were African American people. In the UK, I believe that a huge number of hospital deaths were also Black, Asian, ethnic minority community. So one of the tragedies of coronavirus has been the disproportionate number of deaths among people of ethnic minorities, including doctors and other NHS workers. Now, I would like to explore the reasons for this. So here with me for the discussion, I have right here Dr. Sarah Thomas. She is a pediatric trainee currently working at King's College Hospital. And then on her side, I have Dr. Akwesi Oseyeboa, consultant pediatrician. Welcome to Heart Chat Show.
Thank you, Ajua.
It's amazing to have you here. Thank you so much for honoring the invitation.
Thank you. It's our pleasure to be here today.
Lovely. So COVID, according to reports, it looks like it's really affecting Black and Asian minority. What is COVID?
Well, COVID-19 and coronavirus are some very common terms right now in various households, especially at recent times, I can say.
Yes.
So according to WHO, COVID-19 is defined as a disease which is highly infectious and contagious and caused by a new strain of the coronavirus called as the COVID-19 virus. Which is the reason why this disease is also called as the COVID-19 disease. And it is a highly lethal disease which has affected almost 7 to 8 million people in this world.
Wow.
And across 188 countries. And I can also say that it is a very, very powerful disease as it has managed to bring this entire world to a standstill.
I know, nothing has actually put this world to a standstill. Not even the world wars that we have encountered.
Yes.
People were still working.
Definitely.
But COVID is like a war against the human race.
Definitely, yes.
So Dr. Akwesi, what do you think about this? Has this virus always existed?
Wow, that's a multi-million question. Yes, I mean, nobody's ever thought that this whole world could be affected by this tiny, tiny little organism. Small thing like that. So it makes you actually think that, all the things that we worry about in this world, did they really matter?
No.
It will just take a little thing for everything just get disrupted.
Yeah.
Let's all be happy and make sure you always do the right things and the good things. Yes, I mean, coronavirus, there's always been that myth. I know there's people talk about, I've seen so many things on the internet about documents and films and things that have the name coronavirus in it, maybe years ago, and we were wondering, has it always been there? And there's this document about American preparedness for coronavirus, which was actually presented to the Senate this was in 2014, 2015.
Yes. Is that report true though?
Well, it is true, because the thing is, corona by itself, it's the name for the group of viruses. The name corona, it's a literal meaning, coronation. So it's a crown. So if you look at how the virus looks under a microscope, it's got this sort of globular shape with some spikes that looks like a crown on it.
Yes.
So that's where the name comes from. So it's a name given to a group of viruses called corona. Okay?
Right.
And that type of, those group of viruses have been known to be, if there's any type of organism that can spread through the human race as quick as anything, it has to be those. Because in our history, the type of organism that actually spread through are those influenza, and cold, everybody, you get cold, you sneeze, somebody else gets it. So that family, coronaviruses, are known, and most people, epidemiologists who used to predict what the world could look like if there's any organism that can sweep through the whole world, always mention coronaviruses as an example of the type of organism that can do that.
Right.
So that is why there has been documentations and movies and things like that mentioning coronavirus, not necessarily knowing what will happen in 2020. I mean, if we had the power, I would probably go and see them.
Yeah, because it's quite interesting, because when you look at even the back of Dettol, it has coronavirus in there. So you're thinking, is it something that always existed prior to 2020 and that we didn't know about it? Or did this thing just came out from nowhere?
Yeah. So, I'm sure that is where the thing's coming from. It's a known type of virus in that group. This new one that we call coronavirus is just because when it was first identified in China, it had characteristics that looked like that group. So the very first thing that came out, this is a type of coronavirus.
Right.
But this particular strain is actually called the coronavirus 19, because most of these viruses, the nomenclature, how they are named, is based on the date that or the year that they got described.
Right.
So this is the COVID-19. This particular virus is new. I mean, if you saw a COVID-19 in the 2014 movie, yes, I would come and kind of join your conspiracy. But coronavirus in itself has always been.
Yeah, okay, so they just mentioned coronavirus, but they've never mentioned the year in which.
Yeah, I mean, that strain is different. That's new.
Okay, so is this particular strain airborne, Dr. Sarah?
So this particular strain is said to be transmitted through droplet spread. And what we mean by droplet spread is that when an infected person coughs, sneezes, or even speaks, he can release respiratory droplets from his nose and his mouth, which contain, like each droplet will contain millions of these particles.
Oh, wow, millions?
Millions of these virus particles, which can be in the environment around him.
Right.
And when an uninfected person comes, is close to him or standing around somewhere, he can get infected. And these respiratory droplets not just spread around in the air, but they can also land on surfaces and can in fact last on surfaces for some amount of time, depending on various factors like humidity, sunlight, whether someone is regularly cleaning that surface. So it can last on surfaces for some period of time. Which is the reason why they say, people, when they touch surfaces and then they touch their faces, there is a high chance that this virus can enter their body and infect them.
Right. I mean, people talking about, these droplets falling on different places and all, and you did mention humidity, sunshine and all, because there's this myth that coronavirus does not survive in countries where there's a lot of sunshine. Is that true? Because like back home in Ghana where I come from, there's a lot of sunshine, but the virus is still kind of going. I know the death rate there is a bit lower, but is it also because they are not mentioning that they're hiding the actual death rate, So does this thrive on cold weather, or does it also thrive on sunshine or sunlight?
Viruses generally, most people see them as non-living entities.
Yes.
Because a virus can only survive in the cell of a living organism.
Right.
Without a living organism, the virus in itself cannot survive.
Okay.
So, once they come out of what we call the host, which would normally be some sort of an animal, they last a limited amount of time.
Okay.
Depending on the conditions under which they are. So sunlight. Recently there was a study in America, and then there's another one that will replicate in China. They put this very COVID-19 exposes to sunlight, and they lasted just about 3 minutes in sunlight.
Oh, wow. Okay.
Yes. And humidity, anything less than 30-40%, their survival becomes limited.
Okay.
So when you have, when you have a low humid, warm in a cold atmosphere, so warm in its immediate surrounding, but cold enough to preserve it, then it will survive a bit longer. That's why people who sit in airplanes tend to spread the viruses, because in an airplane you have a low humidity, very enclosed environment.
It is, yes.
And the viruses survive for a bit longer, some number of hours. So the question, coming back to your question about in the tropical area, in the countries, yes, the viruses are there. If they remain in the host, they're fine. But when they come out of the host, then its infectivity will depend on how long it has to stay there till it gets to the next host.
Right.
So it's not necessarily, but then just that's why that whole family of viruses, even in the UK, during the summer periods, the influenza number of cases and things that other members of the corona family, they tend not to be that predominant in the warmer months. Just because once they come out, they need somewhere they need to survive. Otherwise, they just die off. But in a cold, nice, humid area, then they will be able to thrive outside it. So yes, their survival is a bit diminished, but it doesn't necessarily mean that their infectivity is gone down. If they come out now and they get a host, they will infect the person, and then it can spread as it is here, depending on proximity and what happens in the atmosphere at that time.
That's interesting. So I know we've spoken about the droplets and all of that. Can someone also contact it through body contact? So no one has sneezed or there's no droplets about, but then being together, just sitting together next to each other, or holding hands, or having intimacy even, could that pass on the virus?
So according to the statement that was released by WHO, they do say that they have found like studies where people are contracting through body contact.
Okay.
But I must say that studies are still in progress regarding if there are any more other modes of transmission for this particular virus, and whether how infected people are when they are still not showing symptoms yet.
Okay.
So these studies are still in progress. And hopefully we will get more idea about how else this virus can transmit, and more information regarding that.
Amazing. So
there's been quite just to add to what
Dr. Sarah
just said, they've done sort of try to isolate a lot of different body fluids. Unfortunately, most of the body secretions tend to contain. There are very few ones, the feces has been found to have some sort of viruses, and then semen. But a close proximity has to do with, initially it was thought about droplet infection alone. Droplet means you need like a little blobs of saliva or your secretions and the virus to be in there. But there are studies that shows that it can also be aerosol. Aerosol means that just in the normal breathing would have tiny bit of moisture that would have some of the viruses in there.
You also just mentioned semen. Does that mean the semen also carries the virus?
Yes, unfortunately, it's been found to be in some semen.
So couples would have to not have sex when one person has that?
Well, fortunately, it is in semen. But how any organism infects is that they need to get to the door where they can be let in. So how we get infections, if you normally get cholera infections through eating the cholera, the bacteria. But if you have that bacteria, let's say in your eyes, it might cause maybe infection there in your eyes, and then you can just treat it. But that infection in your eye does not necessarily go down to your bowel to give you the typical cholera, diarrhea, vomiting.
So let me get this straight. Does that mean that you cannot transmit the the virus sexually?
No, so it's found in the semen.
Okay.
But the receptors are the openings that the virus need to attach the cell to start the infection process.
Okay.
So how to infect is it goes to they need particular type of cell that the viruses can attack, because their characteristics has shown that they can actually get into those cells. Once they get into those cells, then they can use your cell mechanism to then start living. It's like someone who can only go through windows. And then if you got your window open, if it comes through the back of the door, there's no windows there, they can just stay in the garden.
All right, okay.
Right? But then so sexually, they don't have those particular cells in the vagina or anywhere that can cause the infection to start
So how about
in that person.
Okay.
But then it is there. But having said that, there's a little, people are thinking about the possibility of the viruses resulting in some sort of sterility in men subsequently. But it's all understanding at the moment. But sexually transmitted, not has been demonstrated.
Right. That's interesting. At least it's good to know for couples who are listening. You can get on about your business. Now, what are some of the signs and symptoms of coronavirus or COVID-19?
So according to some of the latest reports that has been published by Public Health England, after they've surveyed all the people who have been affected by this COVID-19, some of the most common symptoms that people who have been affected by this particular disease present with fever, they present with cough, and they also present with breathlessness, where they say, you know, they develop breathlessness by the second or third week of the illness. Some of them have also reported to have loss of taste sensation and smell sensation, and a small minority of the people have also said that they presented with vomiting and diarrhea and abdominal pain. So these are the symptoms that have been, you know, studied and published by the Public Health England. And we're still waiting to hear if there are any more symptoms that could possibly, you know, be seen in people with this particular disease.
Amazing. Dr. Kwesi, do you have anything more to add to that?
Oh, well, I mean, let's just mention all the symptoms, and I think the key thing, people start wondering, I've got these symptoms, I've called 111, they said, oh, stay at home, don't worry, self-isolate. Am I in danger? So what are some of the symptoms to worry so much about? So, I mean, my colleague has actually put everything down in a nice way, but then mild symptoms would be that's the cough, cold, you have body aches, muscle pain, bone pain, a little bit, and then you get, that's the mild symptoms. You get the moderate symptoms where you start having the lower, so it gets deep down to your lungs, start coughing, and then start having some sort of tiny bit of breathing in difficulty, but your oxygen levels will be normal at that stage. Then the moderate, where you really need to start thinking about telling the 111 crew, you know what, I am really breathless. I can climb, I used to climb up my stairs and not feel breathless, but I climb up from downstairs and get upstairs and I'm really breathless. That is the point to think that your body system probably might not be able to cope. That's the point you need to start thinking about getting on to get an ambulance to your house.
Right, okay.
So it's just to fine tune to get people to understand what symptoms to really worry about.
Exactly, because that was one of the questions I was going to ask. At what point do you call the ambulance, or do you call 111, you know, or do you call someone to seek help, you know, at what point? Because I know that a lot of people are a bit worried about even going to the hospital itself, because they think that when they get to the hospital, their symptoms will even be worse, or they'll pick other viruses from the hospital. So I think it's important that you have kind of identified that. Now, what does this virus do to the body, especially after you've contracted this COVID-19? Because I know that a few people have actually mentioned that after they had, contracted this virus, recovering has been a big deal. Some people, I know someone who said they've lost their muscles in their legs and they're now trying to learn how to walk and stuff like that. How does it affect other parts of the body?
The coronavirus in itself, it starts off by getting to, as I told you, where it needs to get into to start affecting you, your lungs. So your lungs has got a particular type of cell. And that cell has got certain protein on that cell that the virus need before it can then gain entry into your body. So once it's in there, you start multiplying, and that's why most of the symptoms and the mild symptoms are always your cough, colds, and those who are even moderate are all related to your breathing, coughing, and oxygen level. So what it does to your body, so it destroys these cells, it messes up the whole idea how your oxygen gets from your lungs into your blood. So your oxygen levels around your body becomes very diminished, very low. Because of low oxygen, your different systems start getting destroyed little by little, and then it affects the whole body.
Right.
So if you look at the journey of somebody who has the coronavirus, starting home with viral symptoms or chest, and then when it starts affecting your chest so much that you cannot maintain your oxygen level, then you need to be put in hospital. And then because it affects every part of your system, the management, or called the supportive care, how to support the various systems, has so many things to it that you need to be put in, you be in bed for virtually the weeks. The average is about 3 weeks. So that all those, so your kidneys back on dialysis, your liver has problems, so your fluid level becomes a bit difficult to manage, and then so all those systems will have to be held and managed until the body itself will be able to recover from the virus.
Wow.
And then when that happens, then recovery, your total body recovery then starts. So that walking bit is actually not necessarily the virus in itself causing a problem, even though if the destruction of the various bodies can affect your muscles, it can.
Yeah.
But when you are stationary and lie down in one place for 2-3 weeks, it's what we call the post-intensive care syndrome. Most patients who've been through intensive care come out feeling very weak, and your muscles are so weak because they've not done much activity for a long time.
Right.
And hence, there's so much pain. If you start shaking, you're not sure what to do, you can't even find your feet, and then you get time. With time, you can get to learn. Like somebody who's been unwell in bed for a long time, they wake up so weak, not necessarily that the disease itself causes some sort of neural problem, but it's just because your muscles have been dormant for so long.
Right,
it loses its bulk, it loses its strength, and then gradually you get back to it.
Amazing. So are Black and Asian, ethnic minority communities more prone and at risk of getting this COVID-19?
Well, according to the report again that was published by Public Health England, where they have done a detailed surveillance and studied the various outcomes and risk factors of this particular disease in people across UK, they have basically suggested certain risk factors that make a person more prone to contracting this particular disease and also sometimes having poorer outcomes. So some of these risk factors were, like, for example, age, where a person found to be over the age of 80 was more at risk of contracting this particular disease as compared to a person under the age of 80. Similarly, they found that males were more affected than females. So in that, one of the risk factors that they've said is that certain communities like the Black community, the Asian community and other ethnic minorities have been found to be more affected by this particular disease than the white British community.
Right.
And in fact, they've also said that they've actually listed out a few reasons that could possibly be the reason why. So they said that it could be because of overrepresentation of the people from this community while collecting the data.
Okay.
And they said that another reason that they've basically said is because people from this community tend to stay in households where there are more number of people and multi-generational
That makes sense, yes.
Yeah. So what happens is that, when one person gets it, it can easily spread across the household and hence affecting more number of people in that particular community.
True.
And one more other reason that they said is that many people from this community are linked in professions which are closely related to COVID-19. For example, like healthcare staff, frontline workers, and various other,
Yeah, it's all the working class people, isn't it?
Yes,
and we tend to be the working class people.
Well, so they are more, of course, at risk of contracting. They're more closely working with this disease, and hence, possibly could be more at risk of contracting this particular disease. And last but not the least, they've also actually mentioned the results of certain audits like the diabetes audit, where they said that people from a particular community, especially the Asian community, are more at risk of acquiring these comorbidities like diabetes and cardiovascular diseases at a particular age compared to their white British counterparts. So because of this, it makes them more susceptible to contracting this particular disease.
Yeah.
And hence maybe that is the reason why, you know, there is a possibility that these communities are affected more. However, there are talks that, you know, there is another report that's going to be published very soon.
Okay.
You know, a little bit more detail regarding this. And hopefully we'll get a little bit more idea.
Clarity.
Yeah.
I think it's actually quite funny because all the stuff that you've said, I think Africans also do get that, isn't it? A lot of Africans are diabetics, a lot of them have this high blood pressure and all of that. So I believe that's this reason why the African and Asian communities have that close link and are being affected a bit more. Now,
Possibly,
COVID-19, is it a sexist kind of virus? Because according to reports, it affects more men than women. Is that the case or is it wrong?
Well, yes. I mean, the statistics from various countries have always shown that there's some sort of predominance with the male. Unfortunately, but we stop here. Then the signs of it. The signs of it does not really. I mean, when you look at just straying into this the ethnic bias, the particular receptor that I talked about, that protein that helps the virus to get in, that protein, that receptor was called ACE2, receptor. That receptor is known to be expressed more in Black and Asian. So there's a science bit to it. But it doesn't necessarily, the males don't necessarily have that predominance. But if you look at the comorbidities, there are other things that affect you getting these, and our lifestyle. Smoking is one of the things, and a lot more males smoke than females. So, is it probably related to that? Yes, the numbers show the males are more predominant, but it doesn't, it's not, nobody's been able to actually we've clearly explained why males are more predominant in deaths and both its infections.
Definitely. I think just adding to that, there have been like a lot of theories that have been put forward as to why males have been more affected than females. And in fact, I did read somewhere that they think that there is a particular gene on this X chromosome that codes for, or that basically says that it basically provides immunity against various illnesses, especially certain viral illnesses. And they think that because, as we know, women have 2 X chromosomes and men have 1 X chromosome. So they think that it's possible that, women have a slightly higher immunity to viral illness compared to men. And another, like my colleague here said, I think another reason could also be because of the comorbidities that you mentioned.
Right.
There is, like, when you basically take women and men at a particular age, women tend to be less affected by these comorbidities because of various protective factors like the estrogen level in their body.
Right.
Hence, men tend to have or acquire more comorbidities such as diabetes and high blood pressure at a particular age compared to their women counterparts, which could also maybe make them more susceptible to contracting this disease. So these are just some of the theories that have been put forward. But there are studies still underway, I guess. Yeah.
This virus is just so complicated. It looks like it keeps evolving. As soon as you see something, it's just changed. It's just interesting. Now, what can we do to reduce the risk of COVID-19, especially amongst Black Asian community?
Well, I would say that generally, the government guidelines have been formulated after studying and analyzing a lot of data. They've been formulated after talking to a lot of scientists and doctors all around the world. And I think these government guidelines are very simple, very practical,
Yeah.
and, very easy to follow. And they make a lot of sense, on looking at how this virus spreads. And, I think following these guidelines is absolutely important. And some of these guidelines say, like, for example, to maintain a 2-meter distance between yourself and someone else who's not from your household.
Right, yeah.
And I think that is one of the guidelines that is very important. Similarly, they say, close your mouth while sneezing or coughing. So we discussed, just before this, how, the virus spreads, and
Yes.
we said droplets spread. So it is important that you close your mouth and nose before you cough and sneeze.
Which is impossible. That's why we have to wear the masks, right?
Exactly. So try to wear masks. Yes. So that's also one of the guidelines where they say try to wear a mask
Yeah.
when you go out in public, especially like in public transport or in shops. And they also say wash your hands regularly, especially when you're outside and when you come back home. And in case you don't have soap and water, at least use a sanitizer.
Yes.
So I think these guidelines are absolutely important, and I think one of my strong advice would be to follow these guidelines, keep yourself safe, and help prevent the spread of this disease.
Amazing. Dr. Casey, do you have anything to add to that in particular?
Yes, I mean, the key thing is, that the practical things are day-to-day, washing hands and things, it's all been said, and it's extremely important.
Yeah.
The thing is, the virus is only as good as what you do to it.
Right.
So if you decide that I want to go and take it on to the next person, or I want to try to go get it, that's when. So that's why I like that saying. It says the best actual protection to the
Yes.
virus is actually your door. So once you
Right.
step out of that environment where you have been for whatever, I mean, your own house, that you can, if it's in your house, it's very difficult to say you're going to run away from it because you got to breathe. But when you step out, that's when you're exposure. So
Definitely.
think, do I really have to do this journey?
Yeah.
Do I really need to meet just one or two people? And if you look at how the virus spreads, one person spreads to two people, so it doesn't necessarily need 100 people to start get you spreading to the two.
Yeah.
Definitely.
You just need two next to you.
Wow.
So that whole thing, okay, you can meet 6 people at a time. Yes, 6, but make sure you keep that distance.
Right.
Make sure you're thinking through. Am I going to take this virus home? I'll try hard not to take the virus home. So those are the practical things.
Yeah.
But other things that can also help is that, I mean, most of the deaths from COVID-19, especially with the Black and Asian community, most of the patients were found to have vitamin D deficiency.
All right.
Vitamin D and C plays a major role in your immune system, how your immune
Yes.
system functions. And so, I mean, we don't have much sunlight, where we're not really gifted with that much sunlight where we live in the UK. I think it would be a good idea
Yes.
to always supplement, so take some vitamin D supplements.
Okay.
I mean, you can take, go to your local pharmacy and then just ask, we want the normal supplementation. There are various doses that can be given. Some they can take once every month or once every day, depending on your own affordability, and then maybe what your lifestyle. What if you think you can take daily ones? But vitamin D supplements, vitamin C supplements, all these things just to boost your immune system.
Right.
So it is the immune system that will stop the virus in its track. So many people contract the viruses every day. Not, I'll say, 8 to 9 people do not show any symptoms.
Yeah.
And this majority of this is hinged on how effective your immune system is.
All right, okay. Now, you spoke about the maintaining that 2-meter distance. There has been a bit of a debate going on about reducing that 2-meter distance to 1 meter. What are your thoughts on it as doctors? Do you think it is a sensible and a wise decision?
I genuinely thought that the 2-meter distance was a very good idea.
Yeah.
Because we know how the virus spreads, and like my colleague here said, the virus spreads like very easily, and it spreads very easily, and the transmission rate is very high.
Yes.
Especially from an infected person to a room filled with uninfected people. So 2-meter distance and reducing it to 1-meter distance can have its effects.
Yeah.
But I think it's still underway.
Because that was my worry. I'm thinking, we're already struggling. Why would you reduce?
To be honest with you, that 2 meters, 6 feet is very old study about droplet transmissions. Not necessarily when it didn't come into effect when COVID-19 came. So studies have shown that if you have droplets, not aerosol, droplets is when the tiny, tiny blobs of secretions come out when you sneeze or you cough or you take a deep breath and it comes out. It can because it's water.
Yeah.
Every distance it goes from you start going down. So it will go down, and by the time it gets to about 4 to 6 feet, it would have dropped to the ground.
Right.
So that is the whole idea behind the 6 feet or the 2 meters.
Yeah.
So the reduction in itself, to be honest with you, it's not based on any science. It's only based on practicality of living with this virus. I mean, we have to.
It's just people making fuss, a lot of fuss about the sea.
This virus comes to stay with us. So
Wow.
we can't close up everything forever. We need to start thinking of ways that we can. So that's why I'm sure with this, trying to get people closer, if we say 1 meter, then you need to think about how do we prevent it. If there is a droplet from get you, then everybody wears a mask.
Oh,
And that's
okay.
why
That's
the government
okay.
is trying to compensate that by
Right.
getting everybody to wear a mask.
Yeah.
Then if you sneeze, it stays in your mask. And if somebody sneezes next to you, your mask is there to at least protect the big one from getting to you.
Yeah.
So that is, I think, the thinking around it.
Amazing. That's interesting. Now, there have been talks about chloroquine being a cure
Yes.
for COVID-19. As doctors, do you think that is the case? Do you think it really works? Or do you think it's just a myth?
Well, hydroxychloroquine has been used for many years now to treat malaria,
Yes.
and it has been used also to relieve the symptoms in various illnesses like lupus and arthritis.
Right.
And recently it's become very popular after President Trump spoke about it in his speech. In fact, there was like a massive worldwide shortage of this particular medicine after that. But coming to the scientific point of view, there was a very massive study that took place in Oxford University, which included about 11,000 patients who were diagnosed with COVID-19. And they wanted to test whether hydroxychloroquine would be beneficial and, have any added benefit to these patients.
Yeah.
And the result of this study was that hydroxychloroquine does not have any added benefit
Oh dear.
to the patients who've been diagnosed with COVID-19.
Right.
And in fact, FDA has also released a warning saying that if hydroxychloroquine is taken in COVID-19 patients, it can possibly result in rhythm abnormalities of the heart.
Oh.
So I think my advice over here would be do not self-medicate.
Yeah.
If you think that you need any other medication other than paracetamol or Calpol, please consult your doctor or call 111.
Now, my final question is, you know how, like back home from where I come from, they would say that there's certain traditional herbs that could help. I don't know about the Asian community, but do traditional remedies actually help with COVID-19?
To be honest with you, that chloroquine has definitely been found not to be effective. And it can
Okay.
kill you.
Right.
It can't kill you. Right. And that same studies, the world quite a lot of centers there's so many medications that are being studied now, and some of them have seen some beneficial effects. So it's not all like gloomy. But
Okay.
some people were hinging on this chloroquine thinking. I'm sure people here they go like, oh my god, are you sure? Oh my goodness. There are some things that probably it's still in the processing that which
Definitely.
shows some sort of
Definitely.
good prospects.
Yeah.
And the herbal preparations and it's where there is currently recently there was this Madagascar issue where
Yes.
they have this preparation. They purported to have proven that it can't clear or kill the virus.
Yeah.
What we tend not to do so much is we see these things. It's very difficult to say that it's not true or it's true because most of these medications we take, most of them are from herbs, are from plants anyway.
Yes.
It's just that tests and research goes into it to see and to prove its efficacy, and then they take whatever the active ingredient it is, and then crystallize that into a medication.
Yes.
So there may be some sort of truth in some of these herbal things, but what I would say is it's within our remit, our own, leaders, our own, but I'm sure back in Asia, in Africa, the need to start investing and try to do a bit more research into these things and then come out with concrete evidence.
Yes.
But
Definitely.
most of the things that we do now, like I'm sure people have heard about ginger, garlic,
Yes.
and all sorts of things, they boost a good immune system boosters. So yes, if you drink a lot of your ginger, your neem tree and things, they've got certain chemicals in them that have been proven to boost your immune system.
Right,
And that
okay.
will help you, one, to stay asymptomatic, no symptoms, even if you get contact with the virus, or two, even if the virus start causing symptoms in you, it will limit the symptoms to mild to moderate and not cause you to get any other failure. So your immune system is the main thing. So the
Okay.
garlic and the ginger is immune system boosters, so they do help.
Amazing. Thank you so much, Dr. Afisio Seyebwa and Dr. Sarah Thomas. It's been an amazing time having you right here on Heart to Heart Talk Show. And thank you so much for the advice you've given us. Please be careful to, not to self-prescribe. Don't go crazy on that hydrochloroquine because it might not help you, So thank you. I think it's a very useful and educational, discussion that we've had here. And I'm sure that it would go out to help somebody else. So thank you so very much for joining us. And if you are watching, make sure you click the subscribe button, like, share, and comment. Thank you.
Heart to heart, soul to soul. Let's speak our minds and make it plain. I'm here for you, you're here for me. Together let's stay.